So joints involved you see is, never forget the cervical spine. Can anyone tell me why do I say you should never forget the cervical spine? Suppose there is a patient who has like a high degree of rheumatoid arthritis is presented to you with a cervical spine pain. What is to be cautioned of? What should you, what precaution you should always take if a person is complaining of a cervical spine pain? Does anyone know that? See, the answer is here, like instability at a cervical spine can lead to impingement of the spinal cord. So, you know that it is impinging the spinal cord. So obviously it will affect the airway also. It can lead to paralysis also, so many things, and even death. Okay, because there is a loss of what is say there is a loosening of ligaments of and there is bone erosion in this case. Okay, and when there is loosening, there is a movement of head to any of the direction, so it is affecting it. So there is an impingement. So which of the I'll show you the x-ray later also. So at what point, at what joint of the cervical spine you see the mostly the impingement occurs? Anyone? Which joint of the cervical spine is the most affected part? There is a thickening of the tissue at that part. Which joint of the cervical spine? Can anyone tell? Okay, no issues. I'll show you later in the x-ray. So see, this also you have to remember. Thoracolumbar, sacroiliac, distal interphalangeal joints of the hand are not involved. Okay, just keep in mind. So what we say when the question can come, so which joints are not involved? So which are the non-involving part? Thoracolumbar, the dip joint, and the sacroiliac joint. So here you can see the pip swelling. This is proximal interphalangeal joint. Okay, you can clear cut see the patient can be presented with such kind of swellings to you. Typical characteristic. See, you can see here in the other diagram is an metacarpophalangeal swelling. Left wrist swelling is also there, and there is an ulnar deviation. See, these are this features you need to see the deformity part. See the pictures carefully. What do you see in there here? There are two types of deformities you can see. This is bottom-ear deformity and a swan neck deformity. Okay, just notice if you have seen patients with rheumatoid arthritis, you must have seen such kind of deformity of hands of such patients. See, you can see there in bottom-ear deformity in the first diagram, the finger is flexed. Okay, there is a flexion of the finger. It is where it is flexed at pip joint, proximal interphalangeal joint. You see that? Proximal interphalangeal joint, there is a flexion, and it is hyperextended at the distal interphalangeal joint. There is hyperextension. See, you see that? So always remember hyper. There is a flexion at the proximal inter and hyperextension at the distal interphalangeal joint. So in the other diagram, you see swan neck deformity. There is a hyperextension. Where do you see the hyperextension? See, it is at the proximal interphalangeal joint, and there is and flexion is there at the distal interphalangeal joint. Both are opposites. Okay. See that? You understand this? Or shall I explain it again? You can just write in the chat box. It is understood? See, both are different and it is like vice versa kind. Here in the first, you see flexion, here it is extension, here it is hyperextension, and here it is flexion. Okay, so always remember bottom-ear deformity and swan neck deformity. These are characteristics. See. Tell me, in this picture, what do you see? Write in the chat box, what do you see here? Where is, at which joint there is flexion and at which joint there is hyperextension? Come on. See, this is a picture where you can see both the deformities of the hand. Index finger, which kind of deformity? Yes, good. Monica Vijay, very nice. And on the other part, second picture, what is this? The ring finger and the little finger. Where is this hyperflexion? See, these images you have to always keep in mind. This will serve a lot in your medical line throughout your life. You will see so many patients. Good. Very nice. So next, what are the extra articular manifestations? So what do you understand first by the extra articular? What is extra articular? What do you say? Yeah, extra articular is. Can anyone tell me the meaning of extra articular? Yes, good. Other than joint. So other than joint, it can affect any part of your body. Okay. Always remember that. So what do you see extra articular? 30 to 40% it can be present. There are high titers of RF and anti-CCP. Have you seen, do you recommend patients who come to you with the joint pains to check for their RF and anti-CCP? Yes or no? If anyone has seen a patient, what do you understand by RF and what do you understand by anti-CCP? Only then it is purposeful. I'll proceed. You should know what is RF and what is anti-CCP. See, extra articular manifestations, you see, I have noted a point may occur prior to the arthritis, and someone has applied rheumatoid factor and cyclic citrulinated antibody. Good. So you must know, see, this is the first and foremost investigation you go for such any of the patient where you suspect. So usually what we do is in our government setup point of view, if I say, we recommend for every old age joint complaining with the joint pain to go for such kind of investigation for RF and anti-CCP. So patient, what you see is there are high titers of RF and anti-CCP, HLA, DR4. Okay, males are also affected, early onset disability and history of smoking. So history of smoking, do you agree it can happen? Would you see in early age groups like in females, males, or in late age groups? Those who have a history of smoking, where do you see the ratio more, in males or female? the correlation of the smoking to this. Males, yes. Why not females? As I told, female ratio is 3:1. See, when you must be knowing, like for the village females, those who are like old age female, they used to smoke. Okay, so the incidence is also more in females also. You should always take a smoking history. You should never miss it. When there is an old age patient that is coming to you, especially from a village, so you should take a history for smoking too for them. Going forward, so extra-articular, it is a constitutional symptom that are most common. Nodules, you should stuck in your mind the rheumatoid nodule. For exam point of view, hematological you see is normocytic normochromic anemia, leukocytosis or leukopenia. There can be thrombocytosis also. So see, but this Felty's syndrome, okay, for exam point of view, Felty's syndrome, you should always remember. 3 points, you have to just swallow it. There's no other option. You have to always remember. What you see is, what is, if a question comes, the characteristics of the Felty syndrome, where it consists of splenomegaly, chronic nodular rheumatoid arthritis, and neutropenia. Okay. So Felty syndrome, you see these 3 characteristics. There is chronic nodular rheumatoid arthritis, there is splenomegaly, and there is neutropenia. Okay. So which of the main system is affected in our body by Felty syndrome, extra-articular involvement? Which of the main system? Neutropenia is there, splenomegaly is there, and there is chronic nodular rheumatoid arthritis. Blood and spleen. Okay. So always remember, the Felty syndrome, mainly the involvement is for the skin and for the respiratory system. Okay. So you have to, these are the pearls you have to remember, the Felty syndrome and its 3 points is a triad. You have to learn it by heart. Next. So the respiratory, as I told, pleural effusion can happen, pneumonitis, pleuropulmonary nodules, ILD. CVS, asymptomatic pericarditis, pericardial effusion, cardiomyopathies also, rheumatoid vasculitis. Okay. So what is vasculitis? Come on. Vasculitis, quick definition. Which is the part that is affected? What, inflammation of the blood vessels? Okay. Blood vessels, or what happens to the blood vessels? That one word is missing. Inflammation of vessels. What part of vessel is affected? So I'll you see, you've written vessels, inflammation of vessels, that is a good thing. So vessel walls are mainly affected, and it is an autoimmune. Our immune system attacks the body and it causes a vessel wall destruction. So it is vasculitis. So cutaneous ulceration, digital gangrene, visceral infarction, and mononeuritis multiplex. CNS, what parts are affected? Peripheral neuropathy, again we have happen, chord compression that I told, impingement of the spinal cord from, and see, this is the I was telling you, which part of cervical spine. Always remember, atlantoaxial, there is a thickening of the atlantoaxial joint, and mid cervical cervine, it can cause spine subluxation, and there is an entrapment neuropathies. What is subluxation? See, these points you have to remember, the technical points. What is subluxation? one word answer. Okay, I'll give you a hint. Partial dislocation. Very nice. Okay, good. Someone is listening. Good. There's a partial dislocation. Eyes. You see, patient suffers from keratoconjunctivitis, episcleritis. Okay, so these things, that extra-articular manifestations, you need to remember at least 4, because when you get a question in NEET, you see they can give you an example and you have to see what are extra-articular manifestation. So you need to remember all these. Okay.